Welcome to my classroom. Today, we will be talking about rheumatoid arthritis. But please, before we start, please remove any lids or hoodies, and I need your full attention. Let's take a closer look. Rheumatoid arthritis. Rheumatoid meaning rheumatism, which means musculoskeletal illness. And arthritis is in two parts. The first part meaning joint, and the second part meaning inflammation. Rheumatoid arthritis, or RA, is a chronic inflammatory disorder. It mainly affects things in the joints, and it often begins there. But the symptoms can then develop into other organs, such as the skin. Here, we have an example of a healthy joint, with the cartilage and the meniscus, which is where RA usually targets. After rheumatoid arthritis is developed in your joints, it causes bone erosion, a swollen inflamed synovial membrane, and cartilage that wears away. It also then causes reduced joint space. And all these symptoms together causes extreme discomfort in the patient. A healthy joint consists of the articular cartilages, which are connective tissues and protective cushioning. It also helps lubricate and help your joints move smoothly, like the bending of the knee. One type of joint, like the knee joint, is called a synovial joint. A synovial joint connects two bones with a fibrous joint capsule that is continuous with the periosteum, or outer layer of both bones. The fibrous capsule is lined with a synovial membrane that has cells that produce synovial fluid and remove debris. The synovial fluid is normally a viscous fluid, like the jelly-like part of a chicken egg, and it helps lubricate the joint. To help serve these synovial cells, the synovial membrane also has blood vessels and lymphatics running through the entire operation. Together, the synovial membrane and the articular cartilage form the inner lining of the joint. RA is an autoimmune process. It is typically triggered by two factors, including genetics and the environment. Big white hairs. Someone might develop RA after they're exposed to something in the environment like cigarette smoke or a bacteria that lives in the intestines that produces a specific pathogen. These people often have a specific gene that is an immune protein, such as the human leukocyte antigen or the HLA-DR1 or DR4. These environmental factors can cause changes and modifications to our own antigens, such as IgG antibodies or other proteins like type 2 collagen. This is Lars. Here's an example of a type 2 collagen. This modification usually happens through a process called citrullination, and I'll get into the specifics later. Citrullination is when the amino acid arginine found in these proteins are converted into other amino acids, citrulline, normal protein, citrulline. You have to understand, the HLA-DR1 and DR4 genes are very susceptible genes. They are Einsteins, and sometimes they get confused. Is this a basketball? From this confusion, they no longer recognize self-antigens. What's wrong with self-antigen again? These antigens are then carried to the lymph nodes and activate the T helper cells. So T cells stimulate the B cells, and they start to differentiate plasma cells. These plasma cells then produce antibodies that start to go against your self-antigens. Then, T helper cells and antibodies slowly start to reach the joints. These T cells at the joints begin to secrete cytokines. They then start to recruit more inflammatory cells, like macrophages, and they all start to crowd the joints. The problem with this is that macrophages will also start to produce inflammatory cytokines. With these two cytokines combined, synovial cells start to proliferate. The increase in synovial cells and immune cells create a pannus, and the pannus is a thick, swollen synovial membrane that carries a ton of scar tissue. It is also made up of various fibroblasts and inflammatory cells. Over time, the pannus damages soft tissue, erodes the bone, and cartilages. In the articular cartilage, the activated synovial cells produce proteases, which breaks down the proteins. When the cartilage starts to disappear, your bones are left naked, and they're bumping against each other, creating lots of friction. In addition, Inflammatory cytokines produce a type of protein on the surface of T cells. This protein is known as rank L. What rank L does is it allows the T cells to bind with the rank proteins. Essentially, this protein is on the surface of osteoclasts, and it starts breaking down bone. Meanwhile, antibodies also enter the joint space. One antibody is called rheumatoid factor. Another antibody is the CCP. No, not the Chinese Communist Party. CCP actually stands for anti-cyclic citrullinated peptide antibody. It generally targets citrullinated proteins. They then form immune complexes that infiltrate and crowd the synovial fluids. Then, they activate the complement system, which is formed of 9 different proteins. Essentially, what it does is it promotes joint inflammation, hence all the pain. Then, the chronic inflammation causes this I can't pronounce it, but essentially it drives more blood vessels around these joints, which causes even more inflammation. As we've mentioned, as the disease progresses, it starts reaching various parts of your body. It doesn't stop with the joints, but it certainly does start there. This is because they like to jailbreak, and they're very good at it. These inflammatory cytokines, they don't like staying in the joint space. They seek the space in the bloodstreams and they start flowing through it, reaching different parts of your body. Because they're so keen on escaping and through the bloodstream, they are connected to essentially the rest of your body. Some worst case scenarios, your nervous system can be fried. Ah, it's burning! Slowly, as your joints degrade and your shoulders and your back and your hips, slowly you're going to start to feel like an 80-year-old man, even though you might be 40. What else did I leave out? Oh yeah, deformities. Deformities are common in RA cases, and sometimes they're inevitable. A very common deformity appears in the extensor tendon of your finger joints. This causes crooked hands. Other results that can be felt throughout the body include shortness of breath due to how the lungs can be affected, and an increased risk to heart attack and strokes. Diagnosis of rheumatoid arthritis usually involves blood tests, like looking for rheumatoid factor. Additionally, X-rays can be used to reveal decrease in bone density, narrowing of the joint space, bone erosion, and swelling. But we all know the most accurate form of diagnosis is, "Hey Siri, do I have rheumatoid arthritis?"
Rheumatoid arthritis is a long-term autoimmune disorder.
Now that we know all about what RA is, so how do we combat it? According to the Mayo Clinic, long-term management of rheumatoid arthritis can be combated through disease-modifying medications, such as methotrexate, which can decrease the inflammation of cells, or biologics like abatacept, which suppresses the T cell's activity. To sum it all up here, rheumatoid arthritis is essentially a systemic inflammatory disorder of autoimmune origin. It is very progressive and causes massive joint destruction, especially in the fingers and wrist. But it also affects other organs, such as the skin, heart, blood vessels, and lungs. But what truly is scary about rheumatoid arthritis is that scientists don't know enough about it, and we don't really know what causes it. So please, stay away from cigarettes. Hey, do you know where I put my lighter?
What? Bro, what are you talking about, man?